These pictures were smuggled out of Zimbabwe, and they give the first real glimpse of the true scale of the cholera crisis. This is one small emergency clinic run by an aid agency in the south of the country. All of the beds are full, and more patients are still arriving, carted in from the rural areas, but many don't even have this kind of transport to make it here. These sisters both have cholera, and they're stranded at home without medical help. The disease has spread quickly through their village, where the only source of water is infected. One child has already died, and more are sick.
Two of my member families that are sick, and there's no medication. So all what need assistance so that my family can be healed, so that they can get better life.
In the capital, where most of the cholera cases have been reported, the health system has all but collapsed. This was the scene inside one of the hospitals in September. Now things are even worse, and yet still Mugabe's regime is trying to conceal what's happening. This woman, a former patient, said that when 10 people die of cholera, they only report 4 deaths. 6 people died in my ward when I was there, she said. There was no fresh water, and we were lying next to the buckets we used as toilets. Most of Harare's doctors and nurses are on strike, protesting over wages that don't even cover the cost of their transport to work. The few still working, like this nurse, talk of desperate conditions.
We are so short-staffed in all institutions. West central hospitals, we do not have adequate drugs and equipment. The staff simply cannot cope. People are dying even at the health institution before being attended to, because this has been worsened by the raw sewage that is flowing freely all over the capital.
The crisis has been exacerbated by hunger. This child is suffering from severe malnutrition. Even the skin on his legs has started to peel. Everywhere there are signs of Zimbabwe's collapse. Money so worthless that it's abandoned on rubbish tips, ignored by those scavenging for food. This is all Mugabe's work, the hunger, the disease, and the hospitals which can no longer save the dying. There are just a few cholera patients in this ward, because the staff have given up and locked the doors. Emma Hurd, Sky News, Johannesburg.